Thank you for joining us today. Today's topic of conversation will dive into implicit biases. If you want to know what implicit biases are and how we can be more aware of them, then stay tuned. Before we start, we are going to give you a scenario. Let's see if you can identify what the implicit bias is in this case. To help you out, we will go into more detail about what to look out for after introducing this scenario. We are working in the emergency room today. A girl walks in. The girl's name is Amy. She's 14 years old. She walked in by herself with no parents. One of our coworkers is being assigned to her. During the first assessment, Amy states that she has been experiencing fairly severe stomach pain and nausea. The coworker decides to go through a couple of questions to narrow down what Amy could be dealing with, including if she is sexually active. Amy says yes, but she's shy and does not like to share more details about it. Nurse decides to rule out pregnancy by performing a pregnancy test, ordering some other tests in addition. Before the other results came back, the pregnancy test results were ready, and it turned out Amy was pregnant. We are documenting other patients at the nurse's station, while Amy's nurse is talking about the results of Amy. We overhear her mumbling, "Oh, another one of those. She must be irresponsible to get knocked up by some guy. And I bet she doesn't even know who the father is." The nurse then makes a comment about Amy being in the emergency room alone, and that she will either neglect her baby like her parents clearly are too, or she will just suck as a mom. Shortly after, we report Amy's nurse for being biased and unprofessional. Were you able to figure out what the implicit bias in our scenario is? Let's hear from Ava what implicit bias is in order to make it a little easier to identify.
Curwen Institute 2014 defines implicit bias as the attitudes or stereotypes that affect our understanding of actions and decisions in an unconscious manner. It's activated involuntarily without awareness or unintentional control and can be either positive or negative. Therefore, implicit biases are subconscious thoughts or judgments that affect our day-to-day lives, and everyone has implicit biases whether they are aware of it or not. It's important that we recognize our implicit bias, especially as a nurse, because if you have a bias towards a certain group or race, it could affect your performance as a caregiver for your patient. This can lead to unfair treatment. Acknowledging your implicit bias will help you provide fair treatment for everyone because knowing what you feel beforehand will prevent yourself from doing anything based on your biases. In order to confront your implicit bias, you must be able to see and understand other perspectives and be open and willing to learn. Now that we know what implicit bias is, Megan and Sarah will talk more about the specific bias in our scenario.
In our bias, we talk about how the nurse says she must be irresponsible getting knocked up by some guy, probably doesn't even know who the father is, and that she's going to be a bad mother and should just give the baby up. Lee Smith Battle 2013 states that some of this stigma is rooted in the teaching system of the Western culture, as they promote abstinence and highlight the dangers of teen sex. The United States teen pregnancy is decreasing. However, compared to other countries, it is still relatively high. On top of the education system failing to educate teens, social media plays a huge role in this stereotype. Social media highlights the dangers and outcomes of teen pregnancy without talking about the real situation at hand.
With that being said, there are 3 things we can do to reduce implicit bias in the hospital. First, we can recognize where our biases come from. With the background information Megan gave us, we are already beginning this process. According to Lee Smith Battle 2013 and 2020, pregnant teenagers defending themselves from unjust treatment can be seen as confirming these biases, that they are immature and uneducated. So, in order to fix this, nurses have to advocate for education programs in the healthcare system. Lastly, if we can't get rid of our biases, nurses should focus on mutually identified goals. For example, focusing on ensuring the pregnant teen is healthy can help distract away from our biases. Now, Kyle will be talking about the impacts of stigma on mental health.
The impact that the stigma has on these young women are so great, it heavily correlates to their mental health, pre- and post-labor, and various aspects of motherhood. In an article written by Lucas, Olender, Ayers, and Salmon from 2019, their research identifies the perceived judgments on pregnant teenagers add on to their levels of stress and feelings of anger and sadness. It definitely doesn't help them in the case of postpartum. Those who felt under scrutiny from professionals regarding their parenting skills did not want to admit to more issues which may affect how they were viewed. Lucas et al. 2019.
It's clear that implicit biases can have serious consequences on the way we perceive and treat our clients, especially in vulnerable situations like teen pregnancy. The story we've discussed reminds us of how easy it can be to let unconscious judgments slip into our interactions, potentially influencing care and damaging the trust that's essential in a healthcare setting. By actively recognizing and challenging our own biases, we not only improve the quality of care, but also advocate for a healthcare environment that respects all individuals equally. This includes supporting teen moms, providing education, and ensuring everyone has fair access to resources without judgment. Let's commit to these steps to foster a more inclusive and compassionate approach that puts the well-being of every client at the center of our practice.